I'm Angela Forfia, and I'm the Senior Manager of Prevention at the American Association of Diabetes Educators. If you were like me, you were enjoying a lovely 4th of July week, spending time with family, going for a swim, having one of those healthy backyard barbecues, when you were shocked by this July 6th news item from the Medicare Learning Network. You might have spit out a little bit of that potato salad, but I'm here to reassure you and help you so that you do not let this happen to you. So let's talk a little bit about step by step how to go through a process of getting your DPP ready to bill Medicare for prevention services. Remember, the Medicare Diabetes Prevention Program builds on the CDC's recognition program. So your first step is, if you're just out there thinking about doing diabetes prevention, is to go to the CDC website and register your diabetes prevention program with CDC. When you do that, you will have pending recognition. You're still going to have to do the program for a year. So you're going to be out there waiting, submitting your data to CDC at 6 months and at 12 months and maybe even at 18 months. And then CDC is going to let you know that because of the great work that you're doing in your community, you are now at preliminary or even full recognition. Once you have reached preliminary or full recognition, you are eligible to be a supplier for Medicare DPP, but you cannot bill for services yet. The next step is that you have to get a National Provider Identifier, or NPI. Now, your organization may already have an NPI, and you can use that same NPI if you have that already. But anyone who is going to be doing the program for you, who is going to be running Prevent T2, will need their own individual NPI. So if you have a nurse, a lifestyle coach, a community health worker who's going to be doing this, they too need an individual NPI. The next step after you have your NPI is to enroll as a Medicare provider. Now, you might say to yourself, I am already ahead of the game. I have been recognized by CDC at preliminary or full recognition for my diabetes prevention program. I have my NPI. I'm already enrolled as a Medicare provider. Let's start billing Medicare. But even if you have been billing Medicare as a Medicare provider, you still need to enroll as a Medicare DPP supplier. It is a separate enrollment process for you. So you will need to go to Medicare and enroll in that particular role, and you might have to wait a little while before you come on as a Medicare DPP supplier. Once you've done that and you are admitted to Medicare as a DPP supplier, then you can start to bill Medicare for all of your prevention services, and you will celebrate because you are helping individuals prevent or delay type 2 diabetes through this program. If you have any more questions, you can always contact AADE at dpp@aadenet.org, or check out some of the links that are posted below that will give you some great resources to make sure that you bill Medicare successfully. Thank you.